If you've been told by your doctor that you need to be treated for your obstructive sleep apnea, but are pretty hesitant about using that CPAP machine, you are not alone. Many people feel uncertain about CPAP machines, especially if their only exposure has been to things like commercials, or maybe their friends telling them that the machines are super bulky and noisy. Today, I'm going to break down what a CPAP machine actually looks like and answer some of the common questions that I get from my patients. Hi, I'm Dr. Val, an integrative sleep medicine physician and women's sleep expert with over 11 years of experience in clinical sleep medicine. And guess what? I myself have obstructive sleep apnea, and this is my CPAP machine. It is the ResMed AirSense 11 machine, and it's an automatic CPAP. Sometimes we call them auto PAPs or auto CPAPs. What CPAP stands for is continuous positive airway pressure. And these modern machines are really much smaller and quieter than maybe what you've seen on your grandparents' or your parents' nightstands. The size of the machine itself is about the size of a tissue box, and there's a 6-foot long hose and a mask that can fit snugly around your nose or even underneath your nose. This is an example of the type of mask that I like to use that just sits underneath my nose. It's missing the head strap that goes around the head. Today's machines are actually really quiet, and it produces really a soft blowing type white noise, and most people don't find it disruptive or even hear it at all. If the mask is dislodged from your face, you may hear a loud swishing sound, but once you shift it back on, it's super quiet. So a common question I get is about cleaning the CPAP machine. It's actually pretty simple. You don't clean the machine itself. The parts that you're cleaning are parts of the mask, such as the cushion. So this is a nasal cushion. You want to clean this every single day because it does touch your face. Once a week, you want to clean out the hoses. So this hose and then the longer hose that connects to your machine. And then also you want to clean out your humidifier chamber. This is the humidifier chamber right here. Additionally, there's a filter in the back of the machine that you also want to check at least on a monthly basis, maybe even weekly if you live near a busy street and you want to make sure that stays nice and clean. Another question I often get is, Doc, how do I travel with that big bulky machine? Well, actually it is TSA friendly, and if you are going on an airplane, it doesn't count as your carry on. It's an additional thing that you can bring. If you want to splurge, you can spend on these travel mini machines. They are actually about $1,000, but sometimes you can find discounts online for a couple $100s off. Another question I often get is, I'm afraid I'm going to get tangled in that hose. Well, there's a couple treatment options for this. There are hoses that can actually swivel around your head because the mask has the hose can attach up here. And so instead of getting tangled around your body, it'll swivel around here. There's also special CPAP hose holders that sort of look like IV poles, and it suspends near your bed or maybe attached to your wall, and so the hose will sort of sway above you instead of around your body, allowing you to move more freely without getting so tangled. Another thing I like to tell my patients is that you may be moving around a lot at night because you're not breathing well. And since you're on the CPAP machine, you may not feel like you need to move as much because now your airway is open. Another concern that patients have is if they have nasal congestion or irritation or dryness. Well, the CPAPs do have that built-in humidifier chamber to help make the air a little more moist, and it can help with dryness and prevent irritation in your nasal passages. Sometimes if you have really high pressures, it can feel more drying, and so there's options that you can actually adjust the level of humidification to your comfort. Another option is if you do really feel dry, your physician can decrease the pressure in that machine, and sometimes that helps as well. So if you've given your best shot, your best effort, you've tried several different masks, and maybe you changed the comfort, you changed the pressure settings of your machine, and you decided, well, Doc, this isn't for me, what else is out there? Well, there are a couple options. One option is an oral appliance, also known as a mandibular advancement device. This is what it looks like, and I recommend the custom ones made by the dentist. And the way this works, it moves your lower jaw forward, because that moves your tongue out of the way, allowing for more space in the back of your throat. They're pretty compact and easy to travel with. Some people use these just when traveling. They leave their machines at home. I always do recommend working with a dentist that is part of the American Academy of Dental Sleep Medicine, as they know what they're doing in terms of making you the mouth guard that fits you and also monitoring for any potential complications such as shifting teeth and jaws. Another option is an implant called the Inspire therapy, and this is a hypoglossal nerve stimulator. So you're going to see a surgeon, you're going to have a device planted in your chest wall with a wire that goes to the nerve to your tongue, and instead of your tongue falling back when you sleep, it gets pushed forward like this. Ideally, it's when you're asleep so you're not noticing it. Well, what is the best option for you? It really depends on your level of comfort, your lifestyle, your severity of your sleep apnea. If you have more mild to moderate, the mouth guard may be a really good option. If you're overweight or obese, losing weight may help. Sometimes I've had some folks just lose, 10 pounds and their sleep apnea severity has dropped. We typically do recommend at least a 10% of your body weight. Sometimes positional therapy can help, meaning just sleeping on your side or getting an adjustable bed that raises your torso. It's really key to work with a sleep physician who understands your needs to help you find the solution you need to treat your obstructive sleep apnea. And I hope that you can find one and find the treatment option that fits your lifestyle and makes you really comfortable when you sleep at night. All right, ladies, thanks so much for watching. I hope this eased some concerns that you have around treating your sleep apnea if you do have it. If you found this video helpful, please like and subscribe for more and watch other videos all about women's sleep health. Until next time, sleep well.